Here's something the healthcare industry doesn't want you to know.
Bill.
Most medical debt in America, and there's a lot, could be forgiven immediately. In order to understand this, we have to go back 10 years to the Affordable Care Act. In the last 10 years, over 7 million people have declared bankruptcy because of medical bills.
The hospital bill came.
It's like 20 pages long.
$8 for an aspirin.
A lot of these could have probably been avoided if people would have known about these policies. One of those things is that most hospitals in America are nonprofits. And that's significant because over 10 years ago, there was a law passed requiring nonprofit hospitals to prove community benefit.
It's like a charity.
It's for charity. You like charity, right?
Basically what these state is if you make under a certain amount of money, hospitals legally have to forgive your medical bills and write it off as charity care. Most hospitals will say, we'll provide free care if you are at or below 300% of the federal poverty line. And then they'll provide discounted care for people that are maybe up to 400%. The problem is that they're not going to tell you that.
This is a very thoughtless omission, Leslie.
We've had millions and millions of people declare bankruptcy over medical bills that they probably didn't have to pay.
Totally avoidable.
So they're not telling people like, oh, by the way, go and do this and we'll provide free care.
So let's just keep it on the down low, shall we?
We have people on payment plans declaring bankruptcy or just living paycheck to paycheck and trying to avoid financial ruin because they didn't have any idea about these policies.
$6,600.
$14,087.
$90,000.
$10,895.
Once it was forgiven, it was literally like a weight had been lifted.
They forgiven $10,895.
When the debt was forgiven, I felt a weight had been lifted off of our shoulders and we could primarily focus on our son and not worry about the bills.
If you know someone with medical bills or you have medical bills yourself, there is good news. A lot of hospitals have these charity care policies and they're pretty easy to find. All you have to do is Google the hospital name and financial assistance policy after it.
Google it.
You can Google it, it's worth a Google.
For example, Legacy Health Financial Assistance. First link at the top will be their policy link. You'll be able to go through their policy, check for the most important thing on here is going to be the sliding scale. Even if you can't get your medical bills 100% waived, a lot of times you can get it heavily discounted.
I'd like a discount.
So now that you've found the policy, you found the application, you complete the application, and the most important thing is going to be providing proof of income. The hospital wants to know who you are, who you live with, and how much money you make. Provide your proof of income, send it to the hospital, and in a few weeks, you should get an answer. We have to get the word out there that these policies exist. We have to tell people that there actually is hope, and we just need to make it accessible for people.